Our next speaker is Dr. El-Bayoumi, who's a physician at George Washington University Medical School. She's a professor of medicine. She's the founder of the Rodham Institute, named after Dorothy Rodham. She has her MD is from University of Michigan, and she did a residency and chief residency here at George Washington. One of the important contributions she will share with us is the high priority in her work for health equity and the role of service learning and medical education in this process. And this is an important thread that I hope you're hearing from the beginning of the first talk with Dr. Brown this morning about the importance of educating physicians and other healthcare providers. It will go through today. Also tomorrow, our esteemed President, Julie Taylor, will give us a lot of information about medical education that she is responsible for and has been leading, and its worldwide impact as well. So I am so thankful Dr. El-Bayoumi is with us to share all of this, a lot of great information. Thanks.
Thank you, and good afternoon to everybody. It's always a challenge to speak after lunch, so I hope that I can make this interesting and engaging for you. It's a real pleasure and an honor to speak, and just sort of as an aside, you know, I am of Egyptian heritage, born and raised here, but the concept of the wet nurse, just to show you how strong it is, when you are fed by a wet nurse, you and you're considered relatives, actually. You cannot intermarry. I'm sure this group already knows that. So, so the immunity and the relationship and all of that, sometimes older cultures, maybe not the scientific, rigorous aspects of the research, which of course is important, kind of gets to these issues way, way before we do. So let me see, okay. How many of you are live in the DC, live and work in the DC area? Okay, so a good number. But for those of you that are not from DC, allow me to use this as an example so that we can, I think it's pretty generalizable to other urban areas. And Washington, DC is like a diamond. Okay, and just to show you, there are two rivers, the Potomac River and the Anacostia River. And often what you will hear is east of the river. East of the river, it basically speaks about Ward 7 and 8. And Ward 8, just to give you an idea, has some of the poorest health outcomes, not just in the city, but also in the country, comparable to other third world countries. Now, it may shock you to know that our health statistics per capita in Washington, D.C., we're number one in not good ways. We're number one in cancer mortality, end-stage kidney disease, HIV. And of course, as with averages, and this is borne out with a number of other studies looking at Seattle and Portland and Atlanta who've looked at these numbers, there's actually more variability in places where there are states. We're not a state, we pay taxes, but we're not represented, as an aside. There's actually more variability within counties than across counties. And so when you look at Ward 8 as an example, the HIV rate there is the same as Namibia's. The infant mortality rate is the same as El Salvador and Cambodia. And that's just not that far away. Just drive a few miles east. All right, so why is that? Well, we can look at the differences in income. I live in Ward 3, where I work is Ward 2. The average family income where I live is about $220,000 a year. Ward 8, it's $22.6 thousand, which is more than or less than what I pay on taxes. Okay. So let me tell you a little bit about Berry Farm, which is sort of the poorest of the poor within Ward 8. That whole area actually was going to be one of the port cities, and Alexandria kind of took over, and there was some competition, and it didn't end up being a port city. But Berry Farm, people tend to think that it has to do with Marion Barry, our former mayor. It does not. Berry Farm was the Berry Farm tobacco plantation. And after the Emancipation Proclamation, 400 acres were actually given to the freedmen. And they transformed it into a thriving African-American farming community. It was they that built Howard University. And just to show you how things have changed, they would work all day and then take their lanterns, walk from all the way across there to Howard University, and they built that university. At the heyday, 1 in 4 residents of Ward 8 actually attended Howard. Now 1 in 4 are in the prison system. Okay, so it's not like these communities were not thriving and flourishing. And what's happening now is that this is prime real estate. The Homeland Security has an eye. There are lots of people that have an eye. It's beautiful. It's beautiful. The trees are mature. The venue, everything is quite beautiful. But there are lots of challenges, and I want to just speak about housing for a second, and this will all make sense when we talk about the social determinants of health. I thought, well, there's all these initiatives to do affordable housing, and that's great, and so forth. But no, what I learned is that how they come up with the numbers for affordable housing actually is if you've got a block, okay, where there are 10 houses, and 2 of the houses, let's say, are for $50,000, they're appraised for $50,000, and the others are appraised for $30,000. They take the average of all of those houses, and that's how they come up with affordable housing. So the 8 families in those are going to be automatically unable to purchase. Okay, that's important. There is the challenge of returning citizens in Wards 7 and 8. Some good news, though, is some of the middle-aged men are beginning to return. And according to residents of Ward 8 specifically, where I did a listing tour, this is seen as actually something positive, which will impact not only on the boy children, but on the girl children, okay? Because girls have really been, sadly, acting out a lot, and part of that is because of missing fathers. Pharmacies, there are no pharmacies that are open 24/7 in Ward 8. There are pharmacies that are open usually during the week, not after hours. Healthcare access, one thing you should know about Washington, D.C., we've got probably the best access to primary care in the country. Because we have Medicaid back, when we were dealing with the AIDS epidemic, having an AIDS defining diagnosis automatically qualified you for Medicaid. So if it was just a matter of access to health care, we'd be #1 in terms of positive outcomes. We're not. And finally, this idea of Ward 9. Ward 9 does not exist, but as people are being pushed out and displaced, they're being displaced into already taxed park communities in Prince George's. So people are referring sort of informally to Ward 9. So again, this is not, I don't think, unique to DC. I'm sure the specifics may be a little bit different, but this is, I think, happening all over the country. So what are the social determinants of health? I know I'm speaking to a sophisticated crowd, but I also never assume, because especially for the physicians that may be in the group, we're sort of the last to catch on to these concepts. Social workers invented the social determinants of health. Nurses, certainly, midwives, etc., get this. But as I say, physicians don't get it. And sadly, just because of the hierarchy of our system, if physicians don't get it, that has a negative halo effect on the rest of the system. So there's an interesting study that was done looking at, I think, Scandinavian countries, sort of the model, at least that I hold, in terms of children and health. And they found out that if you are born into a family that's quite wealthy, that didn't necessarily correlate with whether you were healthy or wealthy or not, or whether you were born into a poor family. It didn't automatically mean that you're going to be poor yourself. Whereas in the United States, what you're born into is very tightly linked to your family. So it's interesting that we sort of hold out the American dream and the possibility of moving, but the reality is that's not at all supported. The evidence is not there. And, you know, again, you've seen the studies where they've looked at a metro line or parts, different geographic parts of a city, and there can be upwards of 20 years of age difference just because of where you live. So let's talk about the social determinants of health. And, you know, you really don't need to look at the numbers because there are different people. Kaiser has numbers, Robert Wood Johnson has numbers, but basically, especially as physicians or clinicians, we think that we have such a big impact on outcomes. And of course, we do for seriously ill people. But overall, our contributions are not a whole lot. So, you know, your social environmental factors. And so if I'm talking about Berry Farm, the amount of construction that's there, the amount of, you know, of poor quality air and water is an issue. Your individual behavior, but of course, your individual behavior is related to access to foods and sidewalks and housing. Your genetics, which of course, as you're finding out, it's not just an on-off switch. There is the microbiome, there are epiphenomena that are related to, you know, exercise, stress probably is going to figure into this. And then healthcare is just between 10 and 20%. Here's another way of looking at the same information. So economic stability, okay, your neighborhood and your physical environment. I think that these charts are very helpful in kind of unpacking all of the different factors, okay? The education, I'm going to focus on that. Food, community and social context, the healthcare systems. You know, despite what sometimes gets presented about poor communities, particularly poor communities of color, I want to tell you that there is a lot of hard work and wonderful leadership and wonderful work to kind of help identify these problems from the people living in these communities. So one of the strongest social determinants of health, it turns out, is high school graduation. So in Ward 8, I mean, I don't know where you went to high school. I went to high school in Michigan and public high school. I can't even think of one person that didn't graduate. We had a couple of pregnant girls in our class, and they graduated as well. So if you think to your own experience, it certainly was shocking to me to find that the graduation rate in Ward 8 is only 42%. That really sets your trajectory for the rest of your life. Okay, so making and impacting that number alone, and we'll see how that feeds into breastfeeding, no pun intended, is critical. So we, as a society, collectively, impacting that number, just moving it a little bit, will have a big impact that will impact generations to come. All righty. So here, I mean, you could show this slide. You know this slide better than I do. Sort of are the breastfeeding rates roughly, and we don't have to look at the numbers really, but just the graph. The more educated you are, the more likely you're going to breastfeed because you recognize the importance. That may be a factor. Certainly education helps, but you put that as a priority. You obviously have the resources which will allow you to prioritize that, right? Either you can take time off from work and you're maybe living in a two-income family, or you're in a workspace where I know at GW we didn't have rooms for nursing mothers, and that became a demand. And there are now places for women to nurse in the medical school, in the hospital, in the clinic. So, and that is not something that was driven by the staff. It was driven by the physicians, because if it was the staff, I can guarantee you it would never have happened. All right, so I want to share my personal story because I think as we sort of reflect about our own individual careers and our work, it's important to know first why we went into the fields that we did. I went into medicine. I was one of these people that was not 5 years of age when I knew that medicine was. I actually was 19. I was in college because I liked everything. Everything was interesting to me. I didn't come from a physician family, but I came from an academic family. My mother's a medical anthropologist, so she's always telling me that don't think you're so great because you're a physician. Anthropologists knew this long before you did and described it. And certainly the third world knows all of this. So So I decided to go into medicine, not just because of my love of science and sort of service, but really for reasons of social justice. And so when I think about that, I come from a family where social justice is multi-generational. That's what drives me. And so if that is sort of what drives us, and I believe that that's something that we all share, given the topic, we have to be more deliberate about thinking about that and weaving it in. Because, you know, what happens is that all of us, we get so caught up on a day-to-day basis in what we're doing that it's important to step back. So I established the Rodham Institute in Dorothy Rodham's honor. She would have been 98 this past Sunday. She died almost 6 years ago. She is actually, the reason I decided to sort of honor her was, I mean, we became dear friends, but also her personal story was one of being able to transcend a difficult childhood. She sort of was dropped off and shipped out from Chicago to place near San Diego to grandparents that were not very nice. They were actually borderline abusive. And they kicked her out of the house at age 14, but weren't for the kindness of strangers who took her in and said, look, if you basically clean the house and watch the children, we will let you finish high school. So education for her was something that was a priority. And let me tell you, even at 92 and a half years of age, she was one of the most intelligent people I have ever met. Voracious reader with a dry wit. Alrighty. So the principles of the Rodham Institute, which is dedicated to health equity, is really working with communities and doing it in a way that is respectful, that's transparent, that's bidirectional. You know, academic medicine not just has a history or a legacy, but really an ongoing legacy of things being tilted against especially poor people and people, you know, who are either differently abled, of color, LGBTQ, older, women. You basically just fill in the blank, communities of color, poor. There's always things have always been tipped back. So it's really important for us at the Rodham Institute, if we're going to go and do work, we're upfront about that. So I always say that gestures reflect principles. When we're meeting and trying to get to know different groups and organizations, we don't have people come to the Mecca. We go to where they are. That makes a difference. We listen. You know, I have the gift of gab, but when I'm meeting new people, I try to listen. You know, the community needs are as listed here. And as you may know, now not-for-profit hospitals are required to do a community needs assessment. It's an IRS requirement. And it was kind of one of those perfunctory things that's kind of put out there. But now a lot of institutions are really taking this more seriously. And if we look at this, this is an opportunity actually to impact policy within our institutions, okay? If it's breastfeeding that the community decides that this is what they want to look at, then that's something that you can design a program that will help to support that, measure it, and keep it going. So we take what we can when this is a requirement, especially if you go to the hospital and say, look, I can help you meet your IRS requirement. They're like, oh, great. Okay, you can do it. We have 3 areas of focus: our community collaborations, which I'll tell you about, and I know I'm running out of time, our help program, and our clinician service learning. In broad strokes, really we as clinicians have to be much more accountable to the society, not just to the individuals or to the families that we're serving, but really to the society. And we are increasingly being held in a good way, I believe, at least under the Affordable Care Act, our outcomes and reimbursement. I think that that is important. And that's what the public is demanding. But I think this is sort of the key right here, is that have you ever seen a flock of geese fly to the south for the winter? It's never the same goose that's leading. They change up. And so if we're going to fly that 3,000 miles twice a year, we have to learn, we certainly have to teach our physician clinicians that, I mean, I love pyramids, but this is one place where pyramids really don't have a role. We are the center, it's more like spokes on a wheel. The patient, the family, the society, communities on the center, but we are working together. And that represents a shift for how certainly physicians have been trained. And that's really an important thing. It's not just lip service. This is important for people to get because it impacts not just our patients. So we have something called See the City That You Serve. If any of you are in DC on June the 16th at 1 o'clock, you're welcome to join us. We take all incoming interns, physicians, assistant students, nurse practitioners, occupational therapy students, and we, since most of them are actually from out of town, only 25% are actually from DC, we start off at Foggy Bottom, we take buses and kind of the scenic route, and we point out the monuments and so forth, but then we cross over into Anacostia because a picture is worth 1,000 words. When they don't see any sidewalks, when all they see are corner stores with fried chicken and Chinese food, right, or no pharmacies, that's much, much more impactful than me talking for the next, year. And on the buses, we have facilitators, our academic and our community partners together because we have an education council that's formed of both. The Health Education Leadership Program targets middle and high school students from Title I schools. And this is meant to expose kids to health careers with a capital H. So from public health to, radiology techs to physicians, nurses, so it's not physician-centric. And even if they're not interested in going into health field after this exposure, they can be health champions. An unexpected thing that we found out when we are doing this is that our biggest success has been with Black boys. And I use the word boys deliberately because we tend to overestimate Black boys' age by 4 years on average. It's important that we remember that there's still boys and children. So I'm deliberate. They're not little men, they're boys, they're kids. So, and this is not for top of the tier, gifted, talented, whatever. These are more actually second and third tier. Actually, we just found out 2 days ago that one of our kids that was teetering on not graduating from high school is going to walk in graduation, which I think is a big deal. And now what we really try to do, the 4 parts of the program, is not only academics, obviously leadership, community service, as well as professionalism. So now what we're seeing is that these same kids are coming back and being big brothers and big sisters. It's actually really great. And I kind of alluded to the fact that staff and physicians, it's a very 2-tier system. So we offer this to lots of people, but we decided to start with the children of the staff who work at GW. Because guess what? A lot of them are from Ward 7 and 8. I'm going to go on, and you can see that they get to do all kinds of fun things, including simulations. This is one of my new boyfriends right here, Mr. Tyler. I met him when I was at an event. He's 6 years old. He was sitting with a bow tie and his glasses. He wasn't wearing a suit. And I said, what's your name? I said his name. I said, I bet you like math, don't you? He goes, I do, and I like reading, and I'm reading a book right now on Dr. Drew, Charles Drew. I said, oh. He said, did you know that Dr. Charles Drew invented the blood storage system? I said, yes, I did. Did you know that he is from Washington, D.C.? I said, yes, I did. Did you know that when he was in a car accident and was bleeding, he went to a white hospital and they refused to take care of him and he died before he could get to the black hospital? I said, yes, I did. 6 years old. Just so I arranged today for him to come and meet some other physicians. We've had some successes. I won't sort of belabor this. The other place where I think, miss the opportunity for education is workplace. If I, as a physician, wanted to go to conference from sun up to sundown, I could go all day. That's all I could do. But yet for the people that work right alongside with us, well, maybe there may be an in-service here or there, or they may be told what they need to do better, but there's really nothing. And yet, first of all, we interact with a team interacting with patients. And second, they're from the areas that are impacted by these social determinants of health. So we've been doing lunch and learns, not just for the social determinants of health, but for their health, for careers, nursing careers. So they can figure out how they want to advance their own education, which studies show that that has a halo effect on the rest of the family. We created a citywide consortium, Pathways for All to Health Careers. So we have the Black Nurse Association, all the academic institutions working to create some of these opportunities together. And it's modeled after the Alameda County Health Program. Please go to our website to learn more details because I'm going to finish up. Our community collaborations, this has been just a wonderful thing because I would say the first couple, 3 years we've been spending on just getting to know people, hearing, listening to what people want. And now that there is trust, people saying, hey, you know what? We would like to create a mental health clinic on site in our church. Will you help us do that? Sure. Because we are at people's service. We're not coming in to impose. We actually did an environmental scan that we commissioned a community health worker to do. It turns out that it's not HIV or diabetes or obesity or cancer that's the #1 health priority in Ward 7 and 8. It's mental health. We have a Healthy Living Festival. I just want to close by talking about by one group as it pertains to the work that you're all doing collectively here. And it's the name of the place is Developing Families Center. There was this woman, I believe her name is Ruth. I haven't met her yet, but I hope to. She's now in her early 80s. 50 years ago, she decided that women in Ward 5, one of the other poorer wards in the city, deserved a place where they could have babies in a birthing center. It took less than 50 years because it's been open for a while now, to realize that vision. So she worked and worked. She actually worked with Secretary Clinton, it turns out. She worked with one of the MacArthur Foundation recipients who's now in her early 90s, who's helping run the center. She had Heckinger's, which was an old home goods store here that went out of business, donated the space. And so we visited the site not too long ago. You walk in, it's beautiful. The rooms are gorgeous. Entire families stay in the rooms. There's quilts. Everything is handmade and just very cozy. There's places for the family. There's, I want to cook or have snacks or whatever. Not cook, but snacks. The mom usually has the baby in 4 hours and goes home. And of course, it's mostly nurse practitioners and midwives that are on. They've got physician backup, but it's a non-physician run kind of place. And then childcare begins at 8 weeks. And we met a woman who herself had been a mother and came and had her baby there, who's now working there. Can I tell you the outcomes are outstanding? 75% reduction in C-sections, 75% reduction in preterm labor and preemies being born. We can and should do better, and when we are looking, especially at poor women, they deserve state-of-the-art, beautiful, clean places that are light and airy, like this room where lots of sun. They have a garden that they're beginning to develop and grow. You go and you see the children, they're happy, they have a Head Start program there. So if we're going to make an impact on babies and mothers and fathers, I think that, of course, we've got our individual lives that we work in the space that we're working in professionally, but also to kind of look around in sort of the informal ways that we exist to encourage a young woman to go to school, especially people that, we see, or to ask these questions. It does make a difference, or to invite a Tyler to come and join you for half a day. Anyway, thank you for your time and attention. I'd be happy to take any questions. Or comments, maybe.
If we have a couple of questions, that would be fine. Let me just remind you also, when you ask questions, please just identify yourself and your institution because we're recording this. Also, as good as you all are for being here and staying here. I think we're going to have no distinct break, but there's coffee and tea and water in the back of the room, so feel free to get that as needed, and we'll just keep on going. And Dr. Young, it is permission to ask a question.
Well, it's not so much a question as to thank you for your presentation.
Welcome, my pleasure.
As a healthcare provider in that community for over 18 years, the determinant that I didn't hear was racism and willful neglect.
Yes.
Willful
Yes.
neglect.
Yes.
Because the intention of this city was to close that area
yes.
off. And had it not been for 9/11,
yes,
the whole place would have been cleared out. And the absurdity of talking about pushing
yes.
Ward 9, which is the richest Black county in this country, to force those over, including the prison, was the intention.
Yes.
We cannot leave that out when we're talking about health outcomes.
It's not left out. It's not left out. That's what I was talking about, the legacy. I mean, I didn't have the chance to go into it, but you're absolutely right, because the truth is these communities, that's why I spoke a lot about the history of Berry Farm, have been deliberately dismantled. Completely. Because the cornerstone, I believe, is racism, classism, but primarily racism. I agree with you.
So my question to you is,
yes.
What do you think we can do to address that fundamental issue that permeates this country?
Oh my, that's a big, big question. Well, if you look at other countries who have undergone collective traumas, such as South Africa, right, with a legacy of 400 years of racism and institutionalized racism, violence against the majority population, they had a truth and reconciliation, discussion. Certainly that wasn't enough, and obviously the wounds of racism carry very, very deep, and it's not just pulling yourself up by your bootstraps, but there has to be an acknowledgement first. I mean, when we talk about the post-racial society because we had a Black president elected, that's nonsense and garbage. And the institutionalization of racism, which really transcends the individuals that may be involved, no matter what the good intentions are. So I don't have an answer for you, but I believe that it is looking at the structural racism, which has to be addressed, because we're all infected with this virus, by the way, to greater or lesser extents. And we have to be mindful that all of us, even those of us that are people of color, have it, because it's a legacy that's deeply rooted. And how do we learn? How do we ask? How are we transparent about this? When people say, oh, I don't see race, that's ridiculous. That's not acceptable. But I think that it's working towards economic justice and to remember, I hate the word empower, by the way. I hate that word because to me, it implies something from the outside. If you notice, I say reclaim. It's about reclaiming, because the wisdom and intelligence and creativity and resilience of these communities really is just unbelievable. It's really humbling to me. And I experience that in my work all the time. But it's about having respect and for the dignity of people, that everybody has the right to be able to have healthy babies, breastfeed, get educated. All these are just basic rights. And one thing I didn't mention, and I'll stop because I know we've got other things, is that I learned something about the social determinants of mental health. And by the way, you can say the social determinants of education, social determinants of health. You know what the biggest, strongest social determinants of mental health is? Food, more than housing. The severity of your illness is directly correlated to food insecurity. So, and then, of course, if you're asking me as another thing, because sometimes people will say, oh, you're getting too political and so forth. The economic argument of not addressing racism and inequity, look what's happening to our society now. It's not like we're thriving, economically or otherwise. So there is that economic argument as well. Did I get at your question? Tried. Anything else? Okay. Thank you for your time and attention.